you guys, this is part 2 of the NHA Ccma exam questions. I'm going to be giving you guys all things NHA Ccma. As I said in my last video, if you answer all these questions correctly, or at least most of them, you're in very good shape as to passing this NHA Ccma exam. If you get a good amount of these questions wrong, that is no problem at all. Just make sure that you study this video really hard, pause it, write down notes if you need to, go back, replay it, do whatever you need to do, because these questions, like I said on my last video, I am pulling them directly from the NHA Ccma exam, especially this video. Okay, all these came from my practice exams, and all these are concepts that I vividly remember having on my literal exam. So make sure you guys pay close attention to these questions. Okay, always remember to like, comment, and subscribe. Copy my links, send this video to a friend if you feel like they may need it or it may help them. And yeah, I love you guys. We're gonna go ahead and get into the video because I know you guys want to hear these questions, so let's go ahead and do it. First question is, a medical assistant is reinforcing instructions with a patient about how to take a buccal tablet. Which of the following instructions should the assistant give the patient? And we have A, swallow the tablet whole, B, place the tablet under your tongue, C, dissolve the tablet in water, or D, place the tablet between your gums and cheek. A buccal tablet is one that you are going to place in between your gum and your cheek. So that is going to be the answer, D. Next question, a medical assistant is administering an injection and the patient faints. Which of the following actions should the assistant take? If somebody faints, hold on, let me read the answer choices and then I'll go in my explanation. A, elevate the patient's head above his heart. That is wrong. You should not move the patient's head. If anything, you elevate their legs above their heart. Apply a warm compress to the patient's neck. Do not do that. You always want to apply a cool compress to their neck, okay? C, offer the patient something to drink. You don't want to do this because at this point, if they are passed out, you don't know what they're allergic to, what they can have, what they can't have, what kind of prescriptions they're on. You don't know anything like that, so you can't get them any kind of drink. So that leaves one answer choice, and that is D, place the patient in a supine position. And supine just means flat on his back. So that is going to be the answer for this one. Where do cardiac electrical impulses originate in the heart? Okay, so answer choices are A, atrioventricular node, B, bundle of His, C, Purkinje fibers, or D, sinoatrial node. And the answer is going to be D, sinoatrial node, because, you know, that's where they originate in the heart. That's going to be something else that you guys are just going to have to memorize. There is a whole diagram that you can look up on like Google or on YouTube, and it'll show you where it starts and how it finishes. A patient who has vulvovaginal candidiasis asks a medical assistant for more information about her infection. The assistant should begin by explaining that candidiasis is which of the following types of infections. So candidiasis is yeast, and yeast is a fungal infection. Okay, next question. A medical assistant requests that a patient pay her insurance copayment at the time she arrives for her appointment. The patient becomes defensive and asks why she should pay for care she hasn't received yet. Which of the following responses should the medical assistant make? And this question is going to be really important, you guys, because this is going to be one of those questions that can be a savior question. This can be something that is easy for you, and it can just get you those easy points. So let's read the answer choices. A, didn't you expect to have to pay for your visit when you came? Question mark. B, why wouldn't you pay now rather than later? Question mark. C, unless you have paid your copayment, the doctor will not see you. Or D, I understand you are concerned, so you're welcome to pay at the end of your appointment. This is a customer service thing. Of course, as medical professionals, we do have to have good customer service skills. So if you come across a question of this nature, you just always need to think, I am doing the best thing for the patient in that moment. What is the best thing for the patient? What is the best thing for the situation? What can I do to calm the situation down as opposed to escalating it even further? So that is the goal. So if you can think of that every time you get a question like this, most of the time you will always be able to come up with the correct answer. And the correct answer here is going to be D. Okay, next. Which of the following cell structures is instrumental in helping the body mobilize and secrete mucus from the respiratory tract? In the last video, I told you guys about those biology terms that you should remember. Here we go. A, centrioles, B, ribosomes, C, cilia, or D, mitochondria. The answer here is going to be C, cilia. Those are hair-like projections, and they are going to secrete mucus. Which of the following routes of administration should a medical assistant use when performing a tuberculin skin test? The answer choices are A, intramuscular, B, intradermal, C, intravenous, or C, subcutaneous. And the answer here for a tuberculin skin test is going to be B, intradermal. A medical assistant is replacing a sharps container in an examination room and receives a small laceration, laceration equals cut, on her arm from the plastic lid. Which of the following types of documentation should the assistant complete as a result of the incident? And A is an advanced beneficiary notice, B is an OSHA form 301, C is CMS 1500 claim form, or D is quality control log. The answer for this one is going to be B, OSHA form 301, you guys. You use this to report incidents that happen to you at work. Okay, our next question is going to be, which of the following items included on the CMS 1500 claim form, this is an insurance claim form, should a medical assistant recognize as indicating the medical necessity of a procedure? And these are just going to be things that you guys are going to have to memorize. So A is modifier, B is diagnosis code, and C is charges, and D is place of service. So the answer here is going to be diagnosis code. Diagnosis code does indicate the medical necessity of the procedure, and the other things don't. The modifier, it's always applied to a procedure to indicate like a special circumstance, so that's not going to be the answer for that one. Charges just doesn't make sense there, so it's not going to be charges. That's charges, kind of like the charges that are applied to your visit. And D, place of service, that doesn't have anything to do with the medical necessity of a procedure. Okay, these last questions are not really questions, but I'm gonna ask them in question form. So I'm not gonna put these on the screen because they're not questions, but they are gonna be on the doc that I send out through Dropbox. Easier. What electrode is located in the fourth intercostal space in the left sternal border? So that is going to be V2. And you never know which one you're gonna get, so I'm just gonna answer all of these. And you never know which one you're gonna get, which is why I put all of them in the doc, so you guys can just go over that. But I'll ask another one just so you guys kind of get a feel for it. What electrode is located in the anterior axillary line lateral to V6? And that is going to be V5. So V5 is lateral to V6 and V6 is lateral to V5. So if you can remember those two, then boom, you got it down pat. Just for those two. The other two, you're gonna have to just know those. Okay. Okay, you guys, what we have next is EKG leads. So my question is going to be, which EKG leads are unipolar? And that question, or the answer to that question, is going to be V1, V2, and V3. Those are precordial and unipolar, and also V4, V5, and V6 are also precordial and unipolar. So yeah, you need to know things like that. You also need to know about the quadrants. So you have, if I'm looking at it right here, we're gonna have right upper, right lower, left upper, left lower, and in the right upper you're going to have the liver and the gallbladder. The left upper you're going to have the left lobe of the liver, and you're also going to have the stomach. The right lower you are going to have the appendix, and in the left lower you're going to have the descending colon and the small intestine. So you need to know those things. All the other things on here I kind of have are not questions, they're just kind of like things you need to know. So you need to know positions, like in that other question where I said the answer was if somebody passes out, you put them in supine position, you lay them on your back. You need to know all those positions. So supine, semi-Fowlers, Fowlers, Trendelenburg, all of those positions you need to know. And you need to know what exams kind of correlate with each position. So for example, if anybody was going to get a rectal exam, you are going to put them in the Sims position. So that would just be an example of how you can kind of navigate or think about those questions, because that's kind of how they're going to be. Know your specialties. So know your specialties as in your cardiologist, endocrinologist, your pulmonologist, things like that. Or people like that. You need to know what they do. You need to know when somebody needs a referral, and then when they do need a referral, you need to know exactly who they're being referred to. You also need to know your readings. So your normal readings for blood pressure. You need to know your normal readings for blood glucose, hematocrit, potassium, things like that. So trying to help you guys out in any way possible that I can, because I want you guys to pass and become medical assistants just like I did. So anything else that y'all need, make sure that y'all let me know, okay? Make sure you like, comment, and subscribe. As always, refer a friend, copy link, paste in the text messages, and send this video to somebody else. Make sure you guys follow me on all my socials. My personal page is __Aniyah. That is __ ANIYAH. There's 2 H's at the end. Other than that, you guys be blessed, stay blessed. I love you all. Try to stay, I don't know where you guys live at, but stay safe always. Always stay cautious. And I'm going to see you guys next time. XOXO.